July is when a new cohort of medical students begin their careers as resident doctors and when pre existing resident doctors level up in the not so subtle hierarchy of the medical world. And during my 5 years as a resident doctor in one of the busiest hospitals in Western Canada, I observed a lot about the unique world of medicine. And what I can say is that the stakes are incredibly high and so are the stress levels. So, one piece of advice that I can offer anyone that's going through their medical training is to maintain a moral compass by asking yourself one simple question frequently. If the patient sitting in front of you was your mother or your father, how would you want them to be treated? And what would be the right course of action? Because what a lot of people outside of the medical world don't get to see is the bargaining and the friction between hospital specialties and also the pressure to cut corners when you're having a really busy day. And how this can manifest is through a culture of gatekeeping or refusing to see or admit a patient. And it can also manifest itself through not doing a diagnostic test or a procedure because it's labor intensive or time consuming. And so, as anyone in medicine can attest to, there will be ways to spin a narrative and to justify not admitting that frail and elderly patient who has poor mobility and lives at home by themselves who is sick with pneumonia. But again, pause and ask yourself, is that the right thing to do? Maintain this moral compass frequently and don't lose yourself. Don't forget why you became a doctor in the first place, especially when you're feeling overworked and exhausted. Because every day that you go into the hospital might feel like just another day in the grind for you, but every patient that you see is coming in on their worst day, and your actions will have a huge impact on them. So, best of luck to all of you who are still in the grind.